how do we stay so isolated for so long? Humans just can't do that.
Nobody can have anything pretty anymore. Everything is soap and water and mask.
Stupid. They are so, that's how I feel. I think it's stupid. Nope, I'm not afraid of it. It's just another disease. It's a cold. It's just like the flu, only a little worse. I'm not telling us the difference between the flu or COVID. I do look at the CDC guidelines, and you'll find that there are more flu deaths than there were COVID deaths this year. It's got boring. I played bridge twice a week. Haven't been able to do that for a year now. And now I sit in my room and play on the computer all day long, or else watch television. And I've eaten, I've gained weight. It's out of boredom. There's nothing to do, nothing.
I stay home more. I don't walk as much. I don't exercise as much. I don't laugh as much. I don't visit as much. I don't. Indoors is becoming a byword. Well, with my husband and me both having it, it wasn't as bad as I thought for us. But it was bad enough. But I survived it, and I'm 84.
And I've never seen the world go crazy over something. I mean, they did during the polio epidemic. That was bad. But I've never seen the world just shut down and destroy people's lives. Some people are so paranoid about the disease, they won't step outside their door. And it's sad. It's sad what COVID has done to people.
And hey, where's the prom dresses and the fun dances and all the fun stuff? You know, it's just sad that they have to miss out on a lot of that.
I just live life. I mean, if it's going to get me, it's going to get me. I mean, I'm going to die from something. So
I don't know. I don't know what God has in mind, but we are learning a lot.
I'm glad she got evicted, because there's no doubt in my mind she'd be dead now if she hadn't been. She was that close. There's been very poor documentation as to the impact on the isolation piece of people with memory disorders. And they said you can do a window visit at first, and or like a Skype call.
They let us start patio visits where we were supposed to sit distanced, masked, which we did. But when they moved us inside, it was a side entrance. I walked into an area probably not much bigger than where we're sitting now, and there was a total plexiglass wall, and he was on the other side. Well, he didn't get it. He spent the whole visit trying to reach me. a fall, and a seizure, and they think a mild stroke, and from that point on, he was only with us another week before, he passed away. So I've never feared it. I'm the high risk. I have autoimmune. I'm a 2-time cancer survivor. Have not given it a second thought.
So my fear wasn't about COVID. My fear was neglect and isolation and her depression and dying alone. I don't think I speak alone. The family members that would visit in person were caregivers, right? All the things we used to do when we used to visit, when we stopped visiting, those cares ceased, and then the actual caregivers in the facilities didn't have near enough time to do those things because they didn't increase the staff. There have been over 7,500 COVID cases in long-term care centers. 49% are staff, 51% are residents. The 51% of residents, 95% of those got the virus from the staff, right? And there was no protocol around the caregivers that worked in the facilities. So when they reopened bars, Jenny looked at some people that were on Facebook that were caregivers that were the ones logging complaints against my mom's activities. And one of them had gone to Vegas and gone to some shows in Vegas, and they'd had pictures on Facebook of them doing shots in a bar in a big group with no masks on. And then they got on a plane and came home, and the next day she was in the facility caring for my mom. I mean, how is that person safer than a family member that typically, I lived in isolation pretty much.
I don't expect them to let an entire family of, 11 people in. But me being there on a daily basis, and if I was agreeing to do everything that a caregiver was doing, you have to remember, the caregivers were the ones that brought the virus in, not family, because we weren't allowed in. We're still not allowed in.
What could have easily happened is somehow we could have funneled more financial resources to the care activity. And if we're going to limit family members and not allow them in, then you got to have an extra 1 or 2 caregivers than you would have had previously. The legislature removed liability from businesses if an employee or a customer gets COVID, the person that gets it can't sue that business. And the legislature passed that early on.
Then CMS came out with directives last September 2020 allowing facilities. They had to let people in. They had to let certain family members into these facilities, for their caregiving purposes. But the facilities seem to have trouble interpreting.
I'm astounded anything gets done in government anymore because I've talked to most every legislator up here. Many of them aren't very responsive. I've found that there's been a few from southern Idaho that have been much more responsive that aren't even my legislators. I've argued with Mary Suiza and Jim Addis and Jim Amador, who are my representatives from my district. I threw out some suggestions on how you could safely allow for a single family member to be a regular visitor. It would have been far safer than what the caregivers that work at the facility went through. All they would do is take their temperature, wash their hands, put on gloves and PPP or whatever, PPE, and then they go to work. So if there was legislation to change, it would be they should definitely separate the licensing requirements for memory care. And that legislation would require more training, more staff, and then they should have definitely done some sort of emergency legislation for funding to allow for more caregivers for as long as they have locked out family member visitations. The PPP gave a lot of money to a lot of businesses to make it through. And many of those businesses didn't need it. I was a part-time mower with the Coeur d'Alene City Golf Course. They got PPP money. The golf course had a record year. So we had all this money that was part of all these programs to support businesses and people to make it through, but we never allocated any to the most vulnerable people, which are, people with memory care.
I heard that there was a death in a nursing home in Washington, in Kirkland. And as soon as I heard that, I said, oh no, if this thing gets into the nursing homes, it's going to be devastating because this is such a vulnerable population of patients that it could really kill a lot of them.
And it's just a little disjointed. And so you started seeing discharges taking a little longer in the hospital.
One of the major goals is not to overexceed what your hospital can take care of. So if we send a lot of sick patients to them all at once, the beds get filled, the ICU gets filled, that would be catastrophic. And now you've got a car wreck down the road and they need to get to the hospital, but the hospital on divert, that patient who could easily be cared for in normal situations has to be transported somewhere else. So we live in a better ratio of environment that we haven't necessarily overexceeded our hospital's ability to take care of people. It was getting close. We're getting pretty maxed out for those guys working in the hospital, and God bless them, but we didn't overdo it and really knock them out of play for many days at a time.
They couldn't say, hey, I need to call my daughter, or hey, I need help. I mean, if you have dementia, you can't really get your needs known. So I think we would see people a little more agitated, because a lot of times in the hospital, a loved one or a friend would stay with the agitated person or the confused person and kind of help them reorient throughout the day, because they don't remember they're in the hospital. They don't remember it's time to eat lunch. So if you have somebody there staying with you, you feel more confident, I think, as a patient. But without that, that's really hard.
I think it slowly grew on them, understanding why they didn't have the visitors anymore. I think that was probably the biggest effect, short of getting the virus, obviously dying of the virus. But the mental part, the social part has been very, very traumatic for these residents who have been without the comfort and care of their family for so long. And it's really taken its toll.
COVID is highly communicable, but also with the proper PPE and the distancing. And I'm not saying they had the resources for that PPE. I haven't researched it. I didn't call each facility, but I really don't think that family and the patients or residents were at risk like they portrayed it. I think actually the risk is probably more their care staff bringing it in from the outside, and there's not much they can do about that. That's really difficult. And despite all of their very conservative approach, most of the facilities had COVID go through the facilities. I was most impressed, as far as just reacting to COVID, to our agency, Hospice of North Idaho. And what I liked about our reaction is they based on the number of COVID patients, that the amount of cases that were being, diagnosed. As the COVID cases increased, then we limited it to 4 visitors that could come and go. Then we limited it to 2 when it was at its height. As the cases came down, we went to 4 for a long time. It was 4. And then just last week, we went to 6, because now we're at yellow again. So I really appreciated that they really just looked at the numbers. It wasn't just this, oh my gosh, we're going to shut down because COVID's here. Because we've never done a pandemic before, I kind of wish out of Boise, like the Bureau of Facility Standards stepped in a little more with specific guidelines, allowing family more access to their loved ones. Because coming from a hospice perspective, I think that's would be very, very difficult to lose your mother, your father, your grandparent, and not be able to be with them.
So we don't see the big rules from the federal government coming down. How do we deal with it locally based on what the numbers look like and what's best for our population? Then it becomes very complicated, sometimes politicized, and then very upsetting to a lot of people who are no longer able to see their family. And I get it. Frustration has definitely been a part of the situation. And everybody's so thankful that there might be a light at the end of the tunnel if we can get more people vaccinated and get past this. And I really hope that once that opportunity comes up, that people will take advantage of that. So we're looking at basically maintaining herd immunity within these facilities by protecting the residents and the staff, and that enough people get it that we don't longer have to be in such a lockdown situation. So that's the way out of here, is better herd immunity within these facilities, but as well as in the community at large. I'm very optimistic. I think that things will definitely get back to normal. I think we'll always be a bit more cautious, and I think we should be more vigilant, because who's to say that down the road it's going to be something else that comes around. We need to be sharp to saying, is there a new virus or new infectious agent out there that we're not aware of? So we need to be more vigilant to catch it early and do the same things that we're doing now, but hopefully at a much rapid pace.
I think that although, yes, there is a large retired population up here, this is a massive issue across our country and around the world.
I think that COVID is going to be gone, but I think our new normal is political, and I think our new normal is bad, because I think the Democrats and the Republicans are fighting too much now. That's what I think.
God knows what he's doing, so I'm not worried about it.
And know where the right resources are. Find the right data, go to the data that you can trust, a source that you can trust. If you're going to be willing to share your thoughts and your opinion, then try to have that opinion as well educated as possible.
Oh, hi, Mom.
David's saying hello. Hello.
Hi. How are you? It's so nice to see you this morning.